My name is James Starr. I'm a hospitalist here at Beloit Health System. A hospitalist is essentially the primary care physician for anybody that's admitted to a hospital setting. We pretty much admit all patients, take care of the vast majority of their health care, and we consult subspecialists as necessary to complete the vast majority of what needs to happen in the hospital setting. I'm a Michigan boy, and I was born and raised in Michigan. I went to Michigan State University. That's where I trained, that's where I worked in my earlier portion of my career. I recently came to Beloit as a locums or a temporary physician. Been doing some work for about 3 years and really like the community. And my kids are now out of the house, and so I'm an empty nester, and I thought I'd try something different, and this was a good location. So hospitals is a general term for primary care for the hospital. It's usually a family medicine physician or an internal medicine physician. They're more generalists. Internal medicine was more of a specialty for adult patients that have a lot of comorbid medical conditions, complicated medical care, which is what drew my attention when I was doing my training. And so in my mind, when I was a kid, it's what I thought I would be when I didn't know what things were. And so as I started learning more about what medicine was, that sort of fell into what felt like home for me. Interestingly enough, when I talked to my dad about the fact that I was in Beloit doing work, and he goes, well, you know, your grandparents met in Beloit. And I'm like, what? He's like, yeah, my grandfather met my grandmother in Beloit. I can't even believe that this is like true, but that's actually what happened. And so he's like, okay, so now you're basically home and you didn't know you were. You know, so it's interesting because I felt like there was a community here. I like the diversity. I like the, you know, the feel of the, you know, the people, and it just felt, you know, comfortable.